This is a documentary of 7 years of development programming by the Mediatrix Development Foundation, MDF, an organization founded by Dr. Linda Ayade, who sits on the board as president. The Board of Trustees of MDF is made up of diversely educated technocrats who have invested their time over the years in providing governance and oversight to its operations. MDF's aim is to improve the lives of women, children, and the less privileged by reducing the burden of communicable and non-communicable diseases within the target populations in Cross River State through effective collaboration with government MDAs, NGOs, CSOs, donors, and other relevant stakeholders. Partnering with Lafarge Africa, Faith Care International, and the Cross River State Ministry of Health, MDF has traversed communities, including hard-to-reach ones, in order to render life-saving health education targeted at behavior change. MDF's health interventions have reached over 45,000 persons in the last 7 years with health awareness messages, and over 19,000 persons with malaria testing services, while more than 4,000 persons have received malaria treatment and insecticide-treated nets. MDF has carried out HIV testing and counseling. Breast cancer screening and financial support was provided to patients who showed signs of lumps to aid further investigation. In the last 7 years, MDF has carried out a total of 738 minor, major, and super major surgical operations, while 17,000 persons have received laboratory services, supply of drugs, eye care, and dental care, all for free.
It's Dr. Monde Yilkudi. I'm the Nigerian Director of Faith Care. We were invited here by the First Lady, Mrs. Linda Ayade, who also has the passion to help her people. So we've done this a number of times with her in the past, and so we're here to do the same thing. During this project, we see patients, people who have medical needs. We pray with them and tell them that we are here to help them, both spiritually and physically. And sometimes it involves doing surgical operations, like here at the theater now. We've done like 15 surgeries from morning today. Very interesting case of breast cancer we just did now. So a lot of patients, you can imagine the patient with breast cancer who does not even know that she has a breast cancer. She just feels there's a swelling here, and then it's really getting to touch the people. And we believe that a lot can be achieved in this country if such programs are organized. Because typically in the villages, the so-called health care that you find in the cities does not exist. So there's a great need for this kind of programs to go into rural areas to help the people. This program, we're supposed to do it in 2 locations because in the past she has invited us to different parts, both north, south. We've been to Obudu, Ugep, Ikom, even Calabar town. So now this place we have not been before, and then from here we're going to Odupani to spend the remaining days there.
These health interventions have yielded massive dividends to communities, and beneficiaries have continued to pour out encomiums, good wishes, and prayers on the organization.
Mrs. Jenny Livinus Imoke. The thing that carry me come here, now my sister problem. She's my senior sister. Her name is Roslyn Eja Etui. She has been suffering this thing for more than 8 years now, cancer of the breast. I took her to Calabar Teaching Hospital. We have done tests like this, first of all in the Tigidi Hospital here. They direct us to Calabar for tests. We don't do tests. That time the thing was small, it was forming in the breast, small. So we don't do every test we do. Now money to take operator, now you know day. Since then, until this thing don't develop very big, it don't come bust. The thing they pain my sister every time. We don't buy drugs, we don't suffer. Then yesterday we come here this free treatment. Now I carry my sister come here. Then today, by the grace of God, she don't enter theater for the operation. We come back successfully. I say glory be to God, and we thank Madam. Any place where you dip her hand to take come out this thing, money, to come do this thing, God go replenish him and he go bless him in abundantly.
Apart from these major medical outreaches to Obudu, Ogoja, Ikom, Gep, Itigidi, Udukbani and Calabar, MDF, in its partnership with Lafarge Africa PLC and with support from the Cross River State Primary Healthcare Development Agency, recently embarked on a 17-day free medical outreach to impact the lives of the most vulnerable in 7 communities across Akakwa and Akpabuyo local government areas. Beyond health, other areas of MDF's intervention are justice and rights for women and children, sustainable livelihood, education, and volunteering. As part of the strategy to achieve her goals in the various thematic areas, every year MDF joins the United Nations and the global community in marking international humanitarian days such as Breast Cancer Day, World Population Day, World Cancer Day, World Malaria Day, International Women's Day, Global Hand Washing Day, International Day of the African Child, World Suicide Prevention Day, and World AIDS Day, amongst others. The organization has leveraged on these global commemorations to create a strategic platform for awareness in the state on universal development issues. In line with her vision and mission, the organization has over the years formed resourceful partnerships and linkages that have led to many remarkable humanitarian interventions. These partnerships include the ones with Faith Care Health Outreach International, United Purpose, United States Embassy Refugee Fund, United Nations Population Fund, UN Women, United Nations High Commission for Refugees, Lafarge Africa, Save the Children, Roche International, Cross River State Ministry of Health, Cross River State Primary Health Care Development Agency, Medical Women Association, First Ladies Against Cancer, and other relevant MDAs in Cross River State.
Her Excellency has actually been our strongest backbone. For instance, I remember in 2017, when we had cause to cry out to her that a child who was terribly sexually assaulted and out of school. Her Excellency did not just support the process of prosecution by lending her voice to encourage the security agencies and the law enforcement agents and even the judiciary to do the right thing, because at some point, the police were very reluctant to even investigate the case, given the fact that the perpetrator was a superior police officer. But because Her Excellency insisted that the proper thing must be done, irrespective of whose ox is God, the police carried out a very thorough investigation. And we are happy to announce that the perpetrator is standing trial. But also very heartwarming is the fact that Her Excellency immediately ensured the girl gets back to school. And not just any school, but one of the best schools in town. And I'm happy to announce that the child has graduated. She brought me this parcel. And I was very happy. You see the excitement in her face. I missed her graduation. She called. She would have wanted Her Excellency to be in her graduation, but for security reasons, Her Excellency couldn't attend it. She rather would like to see her privately. This is what, remember, sometimes we begin to wonder, if we didn't have the kind of person she is, supporting the cause, maybe we wouldn't have succeeded having the man prosecuted. Maybe this girl wouldn't have gone to school, because there's no how. We wouldn't have been able to support her through school. The school fee is expensive. Before she dropped out of school, she was in a public school where with children of the poor. She's a very poor, she's from a very poor home, attending school with very wealthy families. So that has boosted her self-esteem and I think has prepared her for the challenges of tomorrow. That has also helped her to recover from the trauma she suffered as a result of the abuse.
MDF interfaces with activists and the police to ensure that cases of defilement, rape, and other human rights violations are not swept under the carpet. These efforts have ensured the prosecution of several cases and the rehabilitation of victims. IEC materials are periodically produced and distributed to create awareness and sensitize the public on their rights. A rape victim who was rehabilitated by MDF testifies.
My mom went to the market and she asked me to wash my siblings' clothes, the little clothes that was in the house. And she left. She prepared something for us and she left. And I was asked to take my siblings to school. I took them to school. When I came back, I started washing. And my neighbor came from his compound to our compound and asked me, "Where is your dad?" I told him my dad is not around. "Where is your mom?" I told him my mom is not around. He said, "Okay, that he has some piece of firewood in his uncompleted building. I should come go pick it." I said, okay. As a neighbor, I went to get the firewood. And he came in, put me down. He tore my pants. And yes, and he did the deed. And from I cried, he told me I should not tell anybody. Blood was flowing from my body. I should not tell anybody. That if I should tell anybody, I will sleep, I won't wake up, or he will kill me. So I was scared. I couldn't tell my mom. When she came back from market, I cried, my face was swollen. I couldn't tell her. She asked me what happened. I told her, "Mom, nothing." She said, "Okay, no problem." After 3 days, I couldn't bear the pains again because it was too much. Pus was coming out from my body. And I had to tell my mom what happened. So my mom took me to the hospital. And the hospital attendant said they can't treat me in case of anything happens to me. We should go get the police report. We went to the police station at Mokba and got the police report. When we came back to the hospital, they started the treatment. But before we went back to the hospital, the police asked us, "Where is the man? Where is he living?" My mom and the police arranged a cab and took them there. They went and arrested him. When they came, they asked him to give his report, and he said he did it. But Sir James said we should come to the governor wife office. And when we got there, I spoke to her, and I was happy to see the governor wife for the first day. Yes, I was happy. And she promised that she would send me to school. Yes, and she sent me to school. Then I learned many skills. I could dance, I could act, I could draw, I could sing, and all that. I could write, I could speak well. My vocabulary changed.
Yeah, today.
Yes, here we are today, and now I'm a graduate of Holy Child Secondary School, Marangil. I am so happy. She's my role model. Yes, she's a mother to me. She's a 1 in a million. She have tried. It's not easy to take care of someone's child. She have done more than what I expected of her. She helped me everything. I'm so happy. I pray God will help her and bless her with her family. I thank everybody I've seen what doctors have been doing to patients in the hospital, which is not pleasant. At least if I should be a doctor, at least I'll help people one way or the other. Like I can remember Dr. Ayade helped me very, very well. At least out to my pains. He tried just to make me forget about it. And that's why I want to be a doctor. I don't want people to pass through pains. When I see people passing through pains, it hurts me inside.
1,600 youths have been referred for volunteer services, while thousands of others have received training for volunteer services. MDF's health clubs have been established in over 50 schools across the state, while the NGO has organized, facilitated, and supported several literary events, spelling bees, essay and quiz competitions for secondary schools across the state. MDF provided desktop computers for 40 of the schools that have Mediatrix health clubs. MDF's long-standing partnership with many international organizations, including the United Nations High Commission for Refugees, the U.S. Embassy, United Nations Population Fund, and the UN Women, has led to a boost to her sustainable livelihood interventions. 1,815 Cameroonian refugees have benefited from this intervention under the UNHCR project, while under the U.S. Embassy project, about 170 refugees who were found to be living in unconducive, degraded natural environments in the Akankpa axis of Cross River State were provided entrepreneurship and vocational skills training with starter packs to enable them regain dignity and self-reliance and to integrate them into the Nigerian system. MDF's implementation of the UN Women intervention targeted 5,000 women in Cross River State. Under this project, capacity building was provided for women's rights groups and relevant civil society organizations in order to, among other things, strengthen their leadership and voices, as well as increasing opportunities and support towards scaling up activities on gender equality and women empowerment, and the domestication of laws for eliminating violence against women and girls. MDF has also registered women for Entrepreneurial Development School for various skill acquisition and referred some of them to the Bank of Industry for soft loans to support their micro businesses, while over 200 persons were assisted to receive grants from Small and Medium Enterprises Development Agency of Nigeria, SMEDA. In 2023, MDF is set to roll out bigger health interventions, more engaging advocacy programs for women, girls, and children. We invite you to contribute to this philanthropic work today by partnering with us to make life better for the ordinary person in Cross River State.